All right. So welcome everybody. Again, my name is Ashley Foley. I am the director for URI Pre-Health Career Pathways here at URI at the university. I'm joined by a series of our alumni that are joining us here today that are either students within a pre-health professional program or are professionals out in the industry working within these fields and these careers. So we are recording today's panel and it will be available on our YouTube channel, and I will share that link with everybody in the chat so that you have that, so that you can get access to this. We'll also share it out in our Pre-Health Weekly newsletter as well, so everybody can have access to that and join if they weren't able to be here live. But we are joined by a wonderful panel, so thank you all for being here. They are a mix of URI alumni that are currently in their health professional program, as well as our alumni who've been working in their profession for a number of years. So this is really exciting for us. The goal for us today is I am going to be asking a set of questions that will ideally help you and guide you in your decision-making process in pursuing your own health professional career. And so I will let us get started. So to kick us off, I will have all of our panelists introduce yourself. If you wouldn't mind giving your name, your pre-health track, where you applied or attended, and where you are now. And so I'm going to put this all in the chat so we can kind of come back to this just in case, so that we can make sure that we have this information. So I will kick it off with you, Chloe, if you don't mind, starting with your introductions.
With my degree in kinesiology and exercise science, and I'm on that was like the applied track, and now I'm pursuing my doctorate in occupational therapy at Binghamton University. Besides Binghamton, I also applied to Sacred Heart, Johnson and Wales, and Bowling Green.
Great, thanks, Chloe. Kerri, I'll have you kick it off next.
Sure. I graduated a long time ago from URI. I did a major in clinical laboratory science, and then I applied to Brown University through the EIP program, which some of you may have heard of. And because I'm not sure if it's still the same, but at the time it was an early admission, so that was the only place I applied and was lucky enough to get in. I completed my MD at Brown. I did my training in internal medicine and pediatrics, also at Brown. And then I went on to specialize in pediatric hematology oncology at St. Jude Children's Research Hospital. And I worked there as faculty for a number of years, and then made the switch into research. So currently I do pediatric oncology drug development for Johnson & Johnson.
So incredibly impressive. Thank you so much, Kerri. Appreciate it. And Maureen, I'll have you go next if you don't mind.
Sure. I graduated from URI in 2023. I studied biology and thanatology, which I think maybe doesn't exist at URI anymore. And I applied to, I believe, about 12 schools between MD and DO programs. And now I'm a student first year at Rowan Virtua in South Jersey. Yeah.
Thanks, Maureen. And Alex, we'll have you go.
Yeah, I'm Alex. I graduated from URI in 2023. I am now in PA school, second year at Tufts Medical Center in Boston. I applied there to Quinnipiac and then to George Washington in DC as well.
Great. And so on the heels of that, Alex, if you don't mind, we'll kind of lead right into the first question of what do you feel like, and we know PA is slightly different from other programs when applying, but what experiences do you feel like you had, whether that was direct patient care and clinical experience, volunteering, on-campus involvement, maybe research, maybe not, that were the most valuable in your application when applying? Either if that was for Tufts or some of the other programs that you might have been accepted for interviews with as well. Love to hear more about that.
Yeah, so I was a tutor at URI for my junior and senior year. I was biological sciences, and I was a tutor in anatomy and phys 1 and 2. They seemed to like that, I think. They mentioned it a little bit here and there. And then I did take a gap year, and in that time, I started working at a derm office going into my junior year summer. So I had all that clinical experience as well, and kind of worked my way up the chain there, and was part of a research committee there as well. I had a ton of preclinical hours. I got almost like 5,000,
Wow.
which is definitely not what you need. Just, I don't want to scare anybody if that's not like the normal. It's more of like 2,000, 2,500 is what I've heard from my classmates as well. One of my friends told me to get in early, so I was lucky enough to get a little bit ahead of the curve there.
Thanks, Alex. And Alex, if you don't mind me asking, did you decide to take a gap or growth year in between, or did you roll right into a program?
Yeah, so I took the gap year from like I just took one full gap year just because I was kind of taking a break after school, like
Mm.
graduating. And then kind of like midway through the summer afterwards, I started with my CASPA application process, and then realized like, oh, I'm definitely not going to get this done in time. So I just didn't pay attention enough, I guess, to actually get my stuff in line before. It wasn't really an intentional gap year, but it was definitely helpful, I think, overall.
Great. And Maureen, if you don't mind following up on that question, do you feel like from the DO perspective or the Osteopathic School of Medicine perspective, was there specific direct patient care, research, volunteering that you had on your application that you feel like your admissions committees really valued or really kind of helped to set your application apart when applying?
Yeah, so I took 2 gap years after graduating, and spent the entire time working as a patient care tech in a local hospital to me. So that experience, I think, was very important in my application that I had so many direct patient care hours. Um, and then I also, in my time at URI, really varied the kind of activities that I was involved in. So not everything was like directly tied to medicine, I would say. I did research in microplastic pollution. I worked as a RAM and as an RA. So I kind of had pieces of my application that were kind of all over the place, but they were all important to me. So I was able to tie them together, and I think that might have set me apart.
Thanks for that, Maureen. So switch gears a little bit. Chloe, if you wouldn't mind answering a little bit more about how you balanced school, maybe direct patient care, maybe work like a part-time position, other things that you did, on-campus involvement, hard classes that might have been inside or outside of your major that maybe were prerequisites. How did you feel like you were able to balance all of that while also preparing for a rigorous program and an application within OT?
Yeah, so actually, I was lucky enough that I was able to complete my undergrad degree a semester early. And so during that gap between my undergrad and graduate school was when I was really preparing for my application. So it was less stressful experience compared to others that I knew that were still continuing applying to outward and going to schools. Um, but for when it comes to balanced schoolwork and like extracurriculars, I worked in the union, and then I was also part of a sorority, and honestly, that helped me time manage really well because I had a set schedule, which was really nice. I know that it's such a big adjustment, like in school, having like a separate schedule compared to high school, where it's like, oh, you're there from 7, you're there, and then you go until 3. But adding different extracurriculars really did help with my time management.
That's really helpful. Thanks, Chloe. And Kerri, I'm just going to shoot you a slightly different question, mainly from the Brown Early Identification Program perspective. What do you feel like might have made you a competitive applicant? We know that this program is geared towards our in-state students, but since you've mentioned it in your success survey, what do you feel like maybe that you had on your application in that early part of your time at URI that made you a competitive applicant for the Brown EIP program?
I mean, obviously, academics is important for any medical school that you apply to. So you want to, excel there. But I think all of the students who were applying, had excelled there. So setting yourself apart is particularly important. I did tons of activities on campus, from being an RA to a tour guide to an orientation leader, all of the things. I was quite involved. And I think honestly, what cinched it was the interview because I think I was able to communicate really well how authentic I was about wanting to apply. And I can say this now on the other side, I've actually in the past, I helped Brown with their admissions. So I read many applications and interviewed many students. And I do think that that is what separates those who will really excel and those who, the schools want. It's not just doing things and having experiences for the sake of having them, but really for you to reflect upon them, become passionate about them, and communicate that. That authenticity really sets people apart.
Thanks, Kerri. That's really helpful. We talk about this a lot in pre-health of understanding your why and why you want to be the profession that you want to be. Because they'll ask you this question in an interview of why do you want to be a physician? Why do you want to be a PA? Why do you want to be an occupational therapist and not a nurse, a psychologist, any of the other health careers within the field? What is it about being this career is really important for you? So thanks for touching upon that. Kerri, if you don't mind, I would also love to ask you, and Maureen, I'm going to ask you this question as well, if you don't mind, thinking about preparing for those standardized exams that you took to enter into medical school for the MCAT. So this is a large question that we often receive of best ways to study for the MCAT, how to be the most successful when studying for MCAT. So would you take us through that a little bit, maybe for how you best prepared, where you feel like it was really helpful for you, whether that was formalized studying through a program or if that was with your peers. And I know, Alex, you most likely get this at the AEC or you had received this at the AEC, a lot of questions around MCAT. So Kerri and Maureen, if you wouldn't mind speaking to that about studying for that, that would be wonderful.
Yeah, so interestingly, back when I applied through the EIP program, MCATs were not required.
Right.
So I actually never took my MCATs because I got accepted to Brown, and yeah, lucky for me. But that said, throughout medical school, you take a ton of standardized exams for licensure and otherwise. Um, so yeah, I mean, nose to the grindstone, really. That's how you prepare. I mean, you just have to buckle down and focus. I know there are courses available for the MCATs in medical school. There are courses for licensure exams and other things as well. I never took any of those personally. I tended to be a very disciplined student and I could manage my time well, but I do remember some friends of mine who took them and found great value to them. So I think you have to know how you learn best and how you study best. And lean into that. If you know you're not going to stick to a schedule that you make, then don't pretend you will and go and get the help that you need.
That's really helpful. Thanks, Kerri. I know that about Brown, and it went right out there. Maureen, how about you? If you don't mind sharing a little bit about your MCAT studying process.
Yeah, I think one of the most helpful things was that I took the MCAT after having graduated. So because I took the 2 gap years, I was able to take some time away from school before getting back into MCAT studying. Um, and I just kind of made a plan for myself. I had done a pretty good amount of research of what people usually do for their studying, and gave myself a timeline based on that. Used a set of books. It was the I'm gonna forget what brand it was. But it was a set of books that my friend had used for her MCAT, and she had passed them along to me. So that was really helpful for that content review section. And then I just did UWorld and practice exams, and just really grinded on those, and worked about for 3 months. Just focusing on that. I was lucky to be able to live with my parents, so my expenses were pretty low. So I was able to work part-time and really focus on studying, which was very helpful for me.
That's really helpful. Thank you. Alex, I would love to talk to you a little bit about some advice for our students. So, if you feel like you could go back, what might have you done differently? in the application process specifically? So I know that you said that you kind of like were forced upon a growth year or a gap year because of the application, but CASPA application is so very unique compared to maybe other applications within med and OT. So is there anything specifically about CASPA that you wish you would have known about, done differently? Tell us a little bit more about that.
Yeah, if you are interested in being a PA like at all, I would start making like working on your CASPA, and then you can just start entering things as you go. Because I had a lot where I was just not thinking of something and then it would pop into my head and I would add it in as I went through. So I think that having that process is super important. And then obviously the statement, the personal statement is the big thing. That's going to take like kind of the most of your time. So that's something to spend a lot of time thinking about and kind of give yourself a little bit of like thinking time, even just because what you write about is equally as important as what you're writing itself. So picking a topic was definitely the hardest thing for me. And yeah, definitely will take some more time. Definitely took more time than I thought, but that was kind of the whole process. So it's a big thing to do. So it's important to kind of like chip away at it, in my head at least.
Yeah, that's really helpful. There are a lot of resources online that will give you prompts of what the CASP application provides, and you can start to do some of that practice ahead of time, whether that's in a Google Doc, creating and saving all of those experiences and reflecting on them there and starting your personal statement for sure early on can be helpful. And shout out to the AEC Writing Center that helps our students with personal statement writing as well. So that's really helpful. Chloe, would you mind talking about, I know you talked a little bit about your transition from, like maybe a little bit from undergrad into your current program, but what was your biggest adjustment in entering into an OTD doctorate program that was wildly different from maybe what you experienced in undergrad?
So the transition was a little challenging since the program is very demanding.
Mm.
So the biggest adjustment was going from having the same class 2 to 3 times a week to only having it once a week for 3 hours. This made the reading and assignment load a lot greater. So as I was talking about before, time management, that's the biggest thing for me. Like similar to what Kerri said, you really have to put the work in. Like you have to study. Like if you won't follow a schedule, like try to figure something else out when it comes to studying. But be more slow, and as well as like the assignment load, since I am getting my doctorate in 3 years.
That's really helpful. And Chloe, since we're on the topic, and I know that you are here representing occupational therapy, is there anything that you wish you had known about prerequisite requirements for OT specifically that might have fallen outside of your major that you had to maybe add in, or something that you weren't expecting when it came to completing prerequisites specifically for OT? I know we get this question sort of a lot from our students that are thinking about OT, just because they're slightly different from other health professional programs. So I'd love to hear some of your perspective on that, whether that was courses you had to take outside of your major here at URI and what that was like, or were there any prerequisites that were unexpected for you?
For some schools, there were other courses that I had to take as a prerequisite that did not go with the applied track for URI. And that one of them was a research design class, which I personally didn't qualify for, which is an HGF class. So when I wanted to try to access that, I couldn't. So like the way that you would have to do it is do it outside of URI for if you want to go into OT, and like that program requires it. Another prerequisite that wasn't on that track specifically was physics. And that's not required, not to scare anyone, that's not required for most schools. One that was required for Quinnipiac. I remember looking into it, but physics, honestly, I feel like did help me a little bit when it comes to the biomechanics classes as well. But when I was applying, I did make sure you go to the websites of the schools that you're applying to, and it will list the prerequisites that you do need. So if you have a set list that you know where you want to apply, make sure you cover those. Another one that I saw that URI just added was a medical terms, like terminology class, and that was another class that I did like some schools required, but personally for the ones that I picked, they didn't require it, luckily. But I have a friend, Grace, who goes to Tufts for OT, and she did take the medical terminology class outside of school through a community college, I believe.
That's really helpful. So the message there, Chloe, is to look into each program that you're interested in applying for and make your prerequisite list based on the programs. Yeah, so thanks for affirming that, Chloe. I appreciate it. That medical terminology class that Chloe had mentioned, that is a KIN class. I believe it's KIN 222, medical terminology. It is 2 credits and it's always offered online and also offered in the summer. So during summer sessions 1 and 2 typically. So if anybody here in the audience is interested in that, that is an option that you can pursue and take through the KIN department here at URI. Maureen, do you want to share something similar along those lines of prerequisites? Anything that you feel like did your major here at URI kind of line you up really well for those prerequisites? Or were there things that kind of popped up at some of the programs that you were planning on applying for that you weren't expecting?
Yeah, so I did the Biological Sciences BS program, which I found to align pretty well with what was required for both MD and DO schools. It was pretty standardized across them, what they were looking for. So I did cover most of those things. I think there may have been a couple occasions of like looking for more higher level science classes, but I had done quite a few in the CMB track. So they had kind of filled in, and that was just because of personal interest. But it did work out that all of my requirements were filled.
And Alex, if you wouldn't mind picking up on that as well, did you feel like there were any prerequisites for any of the programs that you were planning on applying for that you weren't sure of, that you were concerned about, that kind of were out of the norm for you, that you had to either add on to your major or that you weren't expecting?
I don't think so. I think that all of mine were pretty well lined up. That is something I kind of kept track of. I'm not sure if that was anything that like got added separately or not, but no, I don't think that there was anything that was really all that out of the blue. Nothing that was really that much of a surprise, I should say.
That's great. Kerri, I will transition over to you. Had talked about the interview process and that you feel like your acceptance to the EIP relied heavily on the interview process. And so we talk about interviews and preparing for interviews within the Career Center as a whole, but specifically for pre-health programs and professional programs, that you can be the best candidate on paper. And sometimes it does whittle down and really truly come down to the interview and how the interview went. And so is there anything that you would like to talk about that might have been surprises in your interview for BEIP or any of the roles that you've had since, and how you feel like you might be able to give some good advice for preparing for these types of interviews for our students?
So again, I think it requires some self-reflection. You need to know yourself. Are you somebody who can just talk to other people comfortably without, without feeling awkward or forced? If the answer to that is yes, then you're starting off at a good place. But if the answer is no, then you need to practice. You definitely need to find trusted people who you can sit and, you can look online and find tons of potential questions and just go through them with somebody in a practice environment. I think when it comes to, again, your why are you doing this? The best thing you can do is get experience now, volunteering, research, whatever that is. Place yourself into the setting that you aspire to be in, and be ready to talk about it. Reflect on it. What struck you? Did you get to see a patient with a physician? Did you get to shadow? What was that like? What did you learn in those encounters? Those are the things you want to be able to communicate. I think that's where most of the why for people, it comes from those experiences. So get as much experience as you can in different settings. Maybe you volunteer in the ER and then you do something with a researcher and, maybe a pediatrician, whatever it is. And just be prepared to have some vignettes that you experienced and be able to talk about those.
Thanks, Kerri. That's really helpful. I love that you talked about suggesting for our students that they get in there and get some of this work done. A lot of the questions that come out after we talk about that is, okay, yeah, well, how do I do that, right? Because shadowing is not posted on Handshake, it's not on Indeed. Sometimes getting into the ER sometimes requires a certification like EMT or CNA licensing. How would you suggest that students, what advice would you give for students when it comes to pursuing some of those opportunities? How would you tell students to go about those?
I would say don't be afraid to reach out to people. Um, you'd be surprised, the interest that physicians may give you if you reach out and say, I'm interested in this. Listen, everybody loves to talk about themselves, right? So if you go to a physician and say, I would love to do what you're doing. Can I come and shadow you? Many of them will embrace you with open arms. So use your networks. Obviously there are alumni networks, right? All of us here would be probably very happy to have you work with us. And, work within the people whether they're family connections or otherwise. That's really the key to it. It's not going to be posted anywhere. You have to ask. And if you don't ask, you won't get it. So.
Chloe, I saw you nodding your head a lot there. Would you be willing to share any of your experiences in that as well?
Yeah, so for my undergrad degree, I had to complete a 400-hour internship. Like it was mandatory for me to graduate. And I actually did reach out to a family friend asking if she had opportunities for occupational therapy internships. And I was lucky enough that I was able to spend the full 400 hours like that summer with her. And it was one of the best experiences ever. Through that, I was also able to meet a bunch of different occupational therapists, physical therapists, speech and language pathologists. And that really did help me when gathering letters of recommendation. So do reach out to people if you have connections. They will most likely say yes. And they will also most likely say yes when you ask for a letter of recommendation if you really show that you like to be a part of what they are teaching.
That's incredibly helpful. We could probably spend a whole 50 minutes on just letters of recommendation. So we have a moment. I will get back to it. But I wanted to ask this next question for both Maureen and Alex, because, of course, Maureen, you are pursuing osteopathic for medical school, and Alex, you're pursuing PA. Tell us what a typical day might look like in your program. So, Maureen, I'll have you start if you don't mind. And that could be from didactic through clinical experiences, wherever you're at, but like maybe a typical day that you might see in your program.
Yeah, so at this point in my program, I am almost fully in the classroom. So it is mostly lecture days. My program is non-mandatory lectures and they're all recorded. So on a day like today, I was able to stay home so that I could do this and focus on those lectures later. Um, so it will usually be a lot of that. We also have for my program, since I'm in an osteopathic program, we have osteopathic manipulative medicine lab. So that is a once a week thing. We are able to actually get into a setting where we are performing techniques on our classmates, and having actual like hands-on experience, which I think is really beneficial, especially since it's from like day one of first year. And we also do like our doctoring class. So we do practicing actual clinical applications as well. And so all of those things are intermingled with each other. So a normal day, I'm going to have some lectures on physio, on anatomy, go into the anatomy lab, work on our cadavers, do OMM lab, have H&P class, and then lots of studying, but also lots of free time in first year. I am able to make plans and see my friends, and it's not all consuming at this point.
Oh, well, that's nice to hear. Do you mind talking a little bit about OMM really quickly, Maureen, while I have you in how all of that differentiates between maybe what you don't in terms of what that looks like in DO, because that is truly what is the difference between MD and DO is that manipulative medicine. So would you mind kind of giving us a sneak peek into that and what that looks like?
Yeah, for sure. So, we will typically be focusing on one area of the body. So, our first month or so was focusing on thoracic vertebrae and just all the techniques that are used to regulate those muscles, regulate joint placement, and things like that. So, we do a lot of talking about insertions and origins of muscles and really, really focusing on anatomy so that these techniques are honestly become like very clear and kind of become intuitive as you are studying that anatomy. Um, so yeah, we focused a lot on the background so that when we are going through a technique and we are, it's all hands-on. Kind of I sometimes it can seem a little woo-woo, I like to say. It's like a little bit you're just kind of putting your hand somewhere and like sometimes it feels like you're pretending it's going to work, but then when you actually go through the technique and you think about the anatomy and you think about the why you are placing things where you are, it all does kind of come together. And I do think it's a valuable practice. With Rowan, we do have a preceptorship in the OMM clinic. So we were able to see these techniques actually being used on patients with chronic pain and things like that. And it is really helpful for them. So I do appreciate that aspect of the curriculum.
Thanks, Maureen. And then Alex, how about you? Give us, a typical day at Tufts in the PA program, or whether that's, you're starting rotations throughout different places. Tell us a little bit about what that's like, a day in the life of within the program, maybe starting your clinicals, anything like that.
Yeah, so I'm second year. Ours is a 2-year program. It's like 25 months technically, but so all of last year was didactic, which is kind of a lot, honestly. It's like 8 to 10 classes at a time. For we have like 3 semesters, so we didn't have any breaks for ours. We didn't have some summers off. We would get like a week, maybe 2 weeks in between semesters. But it was pretty much 8 to 10 classes at a time. We counted out it's like 75 total exams for the year or something along those lines, which it does suck. There's no way around it, but we get all of our didactic out of the year and out of the way in the first year. And then now I'm in second year, where starting in January we've been on rotations. So we do month-long rotations, 4 to 5 weeks, and then we just have one big like standardized exam at the end of it. But it's pretty cool because we don't really know. I mean, some people don't like it, but you don't really know your schedule going into it. You just kind of follow whoever you're assigned to. So, like my first semester or my first rotation was like, I don't know, like 30 or 40 hours a week. And then my last month's rotation was like 60 or 70. So it's kind of cool to just see like it's obviously very dependent on specialty and things like that, but you get to see a big spread of things going on because we're not just in like Boston itself, we're in the surrounding area as well. So you get to see a lot of different like diverse patient populations, and it really gives you more of a look into what's going on in the real world, not just in like that one little spot. We aren't just at like Tufts or um, like MGH or any of those specific hospitals. We get to go out and see some more outpatient things and um, get a little bit more of like a good feel for the spread of the patients that you could see.
Thanks, Alex. That's really helpful and informative and great to know a little bit more about Tufts and life as a PA student. So, in an effort to protect everybody's time, it's 1:35, and so I'm gonna ask my last question here. But I would love the audience to take this time to think about maybe a question that I didn't bring up or ask to our panelists that you would want to ask for our panelists. So that will come after this last question that I ask. So you can feel free to start to add that to the chat now, and I can monitor the chat and make sure that we answer, or I can ask that question to our panelists. Or if you're brave enough and if you would like to ask your question to the panelists directly, you're more than welcome to do that. So thinking about any questions that we have from the audience. But my last question for our panelists is, what is one thing that you wish that somebody had told you while you were a pre-health student here at URI? And Kerri, I'll have you start if you don't mind.
Hmm. I guess I I think that this is a hard question because there's I think a lot of things, but um, I think when you enter the health field, even if you've shadowed, even if you've done all the things, you don't really know what it's like. And so I wish I had sort of spent more time, sat down with a physician and said, tell me like everything about residency and what is fellowship like and to really get a sense of all of that so you know what you're going into. So if you are serious about an MD or a DO program, I would really recommend that you do that. And even lifestyle factors, right? Because that matters. Like, what is it like being a neurosurgeon versus being a dermatologist? Really exploring those things. So I would have gotten more advice from the boots on the ground, I think.
While we have your incredible wealth of knowledge, Kerri, what was your fellowship like? What was some of that like for you?
Oh, yeah. So I did my residency before they started work hour restrictions. So it was crazy. I mean, we would work, you know, 36 hours and then have a few hours to clean up what we were doing before we could go home. Those were different days. They implemented the 80-hour work week when I was probably halfway through my training. I'm not sure what it is now, but I know that they've made things better for residents. I think one of the skills you will have to attain is, how do I adequately hand off a patient and adequately pick up a patient? How do I know enough about this patient to be able to take care of them? You're tired, it's a lot of work, but it's really the opportunity you have to learn as much as you can because the reality is once you're out there as an attending, that's scary. You no longer have people to turn to, formally. You can informally ask your colleagues, but that was actually the hardest year. It was when I became an attending because, and nobody tells you that. It's harder than when you start residency. You're very protected in residency. There's lots of people to ask questions to. I always tell residents, ask every single question that comes to your mind now because at some point you'll feel like it's too late. I should know this by now, and now I'm embarrassed to ask it. So always, always, always ask questions.
Thanks for that, Kerri. I'll flip this question over to you, Chloe. What do you feel like you wish somebody would have told you as a pre-health student at URI?
Remember to prioritize your mental health and your well-being.
Mhm.
The application process is very stressful as well as even your first semester. So your sleep is important when it comes to exams. Make sure to try to maintain your relationships with people because that will really help you throughout the application process as well as just your first semester and getting acquainted with other people. And no profession is ever worth your mental health. It will be okay. Everything will be okay.
That's really helpful. Thank you, Chloe. Maureen, how about you? Anything that you wish you had known or wish somebody had told you?
Yeah, specifically for the application process, try and find a buddy or two who is going through it at the same time as you. Especially doing it outside of school, it can be pretty isolating and pretty confusing, knowing if you're doing the right thing during application. So try to find someone who is going through it with you.
Thanks, Maureen. That's great advice. And Alex, how about you?
Um, my program was very specifically like, do not compare yourself to others. Everybody kind of has their own like track to getting to where they want to be. All of these programs and everything are super competitive. So like, don't freak out if you see people around you getting in before you. There's just got to have like kind of a mental list of things you got to get done, and then just kind of check them off as you go. And everybody will get to where they want to be if they are interested enough, then they'll be able to stick with it. So, like, don't freak out if you see everybody else. It's hard to, but try not to be comparing anybody to yourself.
Yeah, collaboration, not competitiveness, right? I feel like that's a good one. Alex, actually, while we're on while we're working together here, one of the audience members did have a question for you specifically. They are also pre-PA and also work as a tutor in the AEC. So shout out to our AEC team here today. But what transferable skills did you have as a tutor that you feel like your PA program were interested in? You had mentioned that a little bit in the beginning, that a lot of the admissions teams that you had interviewed with had talked a little bit about that. What are some specific transferable skills that you feel like you learned as an AEC tutor really stood out in your application or your interview?
I was just typing up a response to that. I
Oh,
don't
thank you.
think I don't think there's anything like I can't pinpoint, one or two things that it really shows specifically for skills, but I think that it just shows that you have the ability to convey information effectively, and if you can actually teach somebody else something, they say that that's the best way to study is to teach somebody else. So I think it more of just gives you the skills, or it shows that you have the skills of communicating information effectively. Um, and I think that it just has like that you have the initiative to go out and do something above and beyond what you already are doing. So it kind of shows that you really are interested in what you're doing, specifically if it's about things like pre-med or pre-PA or whatever it is related. Um, so yeah, I don't know if I have like the specific answer for what skills, but it's kind of a conglomerate of things of just giving them a more well-rounded picture of who you are as an applicant.
Thanks for that, Alex. Another great question from Brooke. So thank you for this, Brooke. And I'll leave this for anybody that might want to answer it. Do you think admissions values hands-on experience and volunteer opportunities over a few poor grades during undergraduate studies?
I'm happy to talk about this. I think it can certainly offset, if you have some blemishes on your transcript. I think if you are a good communicator and you're passionate and you truly understand why you're taking the path that you're taking, and you can draw from those experiences, do the two cancel each other out? It's hard to say. It really depends. But I certainly think that it can compensate for, a few courses that you may not have done as well as you wanted to.
Chloe, do you have anything to add to that, if you don't mind, from the occupational therapy perspective, specifically for OT programs? Do you feel like that they valued more of your hands-on experience versus your grades, or vice versa? Did they hold both in equal measure?
I definitely did work hard for my undergrad degree, but I really do believe that the hands-on patient experience that I gained through my internship really made me stand out. When I went into the program, I did feel a lot more comfortable compared to other individuals that are in my program when it comes to patient experience. I felt more comfortable talking to new clients and all of that. So I do think that for occupational therapy, it is a big thing, is the hand-on experience over the grades.
Alex, do you mind speaking? Thank you, Chloe. I appreciate that. Do you mind speaking a little bit to that about from the PA perspective, Alex? We know PA is extremely competitive, almost like right up there with med school right now. So would love to hear your perspective there.
Yeah, I actually had the chance to talk to our admissions committee and kind of sit in on some of their, like obviously I didn't have any say in it, but just got to sit in on some of their meetings. And we had like almost 5,000 applicants for 50 spots. So it's really like they were saying that if your grades are like a big drop off, then obviously that's kind of a big red flag in their eyes. But if it's something that's competitive, and then we as PA applicants have the ability to have a bunch of preclinical experience, so they value both, I guess is what I should say. But they, if there's a huge deficit in either of them, then that's kind of where they start to draw the line and say like, what's going on here that we don't see, or things like that. But yeah, as long as everything's kind of like somewhere close, they're not super specific on like a big cutoff.
That's helpful. Thank you. There is an awesome question, a couple of awesome questions in here, and I realize that we're running a little bit out of time. Maureen, there is an amazing question in the chat for if you don't mind taking a look at that and letting me know if you'd like to answer that, and no pressure by any means. Let's Sorry, Maureen.
I would love to speak to that.
That's wonderful. Thank you so much.
Yeah. So yes, I am non-binary, and that is not a massive population in medical school. But I was very upfront about it when I was applying. It was incorporated into my application, and I was very upfront about my identity, during interviews as well. And it was very important to me that I was seeking out schools that were going to be accepting of that, and were not going to and that have like a diverse population, both within like gender and sexuality, I would say. So yeah, I have not encountered any like adverse experiences with it. It's pretty much, people don't really blink an eye. I have on my ID that I wear everywhere, I have my pronouns on there as well. And people are very good about it. So I would say that should not be a deterrent for anyone who is maybe concerned about that.
Thanks so much for that, Maureen. I really appreciate it. And Professor Brasher had asked us, and this is kind of where I'll leave us, but did you have interest from the beginning of college, or what was your starting spark for a career within pre-health or for within the health professions? And Maureen, I'll have you kind of kick off that question there.
Sure. When I first applied to URI, I wanted to do forensic science, and
Ooh.
potentially do forensic pathology. So it was always kind of in the same vein of wanting to do med school. But I really like narrowed down that path as I went on. But yeah, I was definitely considering it from the beginning.
Chloe, I think we lost Chloe potentially. Alex, I'll have you hop on that too. Did you always have an interest in pre-health, or was it something that kind of came later for you?
Yeah, so I was interested in something medical at the start, but I wasn't entirely sure. And then I think Maureen and I graduated the same year, so we were like our freshman year was the COVID year. So I actually took off my whole sophomore year, and then I almost didn't come back. I almost just kind of like didn't return to school. So um, yeah, it was an interest from the start, but then I was kind of like a roundabout, like I didn't really know what I was doing for a second there, and then finally came back. So um, yes and no, I guess.
Thanks. And Kerri, I'll have you finished up that. Was that always an interest to you, or did something happen throughout college that sparked that for you?
Yeah, similar to the others, it was always sort of there in the back of my mind. My going in position was med school is too long. I don't want to go through all that training.
Mm.
I'm going to do something else. I'll get a PhD. Um, and then a friend of mine was pre-med, and we started talking about it. And I was like, I mean, I have to, the time's going to happen anyway. I may as well work
Mm.
towards something that I think I would really love. And so once I mentally broke that barrier of the commitment, I was able to, you know, embrace it more. And that's when I decided I was going to apply.
That's helpful. I think that, sometimes there is a major concern about the commitment, the time commitment of pursuing medicine. So thank you for that, Kerri. The time is going to happen anyways. Might as well do it doing what you love. So I love that. So this is going to wrap up our time together. Thank you so much to our panelists for being here today, Maureen, Kerri, Alex, and Chloe, for answering these questions and guiding our students and helping them to be able to pursue a similar path or something within the health professions. We know that it's competitive. There's a lot that goes into it. And so being able to see success from successful professionals who are in these seats that you see here right now, here down in Kingston, we really appreciate it. And thank you so much, Professor Brasher, for bringing your students here and being here today. Thanks everybody from Social 224 for being here. I truly appreciate it. And so I'm going to end our recording for now. Feel free to stay on if you have any questions. I put in the chat our website for you to be able to stay up to date for pre-health. So you can take a look at our website, sign up for our newsletter if you're not already there. And Alex and Maureen both have some helpful information in the chat as well. So thanks so much, everybody. Take care.
Thank you. Bye.
Thanks.